Hello, Gemini. Could you see my
Hello.
screen?
Yes, I can see your screen. It shows 2 documents with flowcharts for treatment of hypertension in non-pregnant people with diabetes.
Yes, in the left side is the ADA guideline in 2024, and in the right side is ADA, the guideline about the cardiovascular disease in 2025. Can you point out any differences in detail as possible as you can?
Okay, I can help with that. The left side guideline is from 2024, and the right side is from 2023, focusing on cardiovascular disease. Both flowcharts provide recommendations for the treatment of hypertension in non-pregnant people with diabetes, but there are some differences. Let's take a closer look. On the left, the first step is to determine whether the patient's blood pressure is initially below 130/80ths or 150/90ths. In contrast, the flowchart on the right initially looks for readings under or over 130/80ths. If the pressure is below 130/80ths on the left, the next step is to consider if there is albuminuria or CAD, while the flowchart on the right side jumps to the next step of either starting 1 or 2 agents. Do you want me to go through any other differences?
Okay, please go on.
Sure, another key difference is the point at which lifestyle changes are recommended. In the 2024 guideline, lifestyle changes are recommended only when the initial blood pressure is below 130/80ths. But the 2023 guideline recommends lifestyle changes for initial pressures at 130/80ths or higher before considering any medication. In the 2024 guidelines, the first choice of medications, if there is albuminuria or CAD, is either ACEI or ARB. In the 2023 guidelines, the first choice of medications is either ACEI or ARB, irrespective of albuminuria or CAD, and only with a positive answer of albuminuria or CAD, it jumps to starting with 2 agents. Should I continue, or is there something else you'd like to focus on?
Okay, could you to see any the subtle differences between these the two figure in these 2 years?
All right, I'll point out some subtle differences. On the left, for initial blood pressures of 130/80ths or higher, lifestyle changes are only considered if albuminuria or CAD is present. The right side guideline recommends lifestyle changes before any medication, regardless of albuminuria or CAD. Also, on the right side, if the patient has albuminuria or CAD and blood pressure over 130/80ths, they recommend starting 2 drugs right away, while on the left, it recommends starting 1. There are some subtle differences in which medication to add as a second medication as well. Anything else you'd like to explore?
Yes. Do you see any difference in the additional medication if the blood pressure is not undergo?
Yes, I see differences in the additional medication recommendations. On the left, if the treatment target is not met after starting with 1 or 2 agents, the guideline suggests to add a complementary drug class of either CCB or diuretic and assess BP control and adverse effects. On the right, the 2023 guideline recommends adding any complementary class of medication, such as CCB or diuretic, or to consider a change to alternative medication, and they also assess treatment effectiveness and adverse effects. Do you want to discuss any other differences?
Okay, I understand. Thank you.